Hello, everybody. Thank you very much. Thank you very much for the invitation. Apologies for my connection. It seems that it's not working very well and my camera is not turning on for some reason. It's on, but it's not working. So apologies for that. We certainly are in face of an emergency, of a crisis, of a multi-layered crisis and emergency. And I think it's clear that this emergency crisis is forcing us, pushing us to focus on priorities. It's bringing the priorities up front, but also the possibilities and expanding the imagination of the possibilities. I think it's very important to keep this in mind. And in terms of focusing the priorities, I think it's very, very clear for everybody that care and ethics of care is at the center of that. And that means that, of course, we are all connected and taking care of each other is crucial. And that it's not possible for one individual to remain healthy if everybody is not remaining healthy at the same time. And the pandemic is putting that very clearly for all of us. So that means basically two things that we have been working on for several decades now. Many of us, when I say we, is many of the people actually participating in this call from the local governments and regional governments perspective, from the international organizations and the UN and rapporteurs and other multilateral organizations, but also civil society organizations, platforms, social movements, etc. And these are of course, the human rights approach. So, and human rights approach as not just an ethical, a political, but also a programmatic approach to actually implement that ethics of care. And that means, of course, universal access and guaranteeing and protection for human rights. Priority attention to the most vulnerable groups, of course. But also interdependency and interdependency of all rights. So it's clear that housing is crucial, has been always crucial, and is more crucial even to face the pandemic. And it's clear for everybody now. And that we cannot link the right to housing to the right to property, because the pandemic is not asking for your property titles, right? Or for your rental contract in order to decide if it's going to hit you or not. So this is very clear. But that interdependency also brings to the front the connection between housing, health, education, food security, water and sanitation, of course, other basic services, education, and so on, all things that have already been mentioned. And the second thing, so that's one, the human rights approach. And the second thing is that interdependency and connection is more clear when we look at that from a territorial approach, from a proximity, territorial, integral approach. And that's also clear and has been made clear by this pandemic. And the need then to have an integral policies taking care of these issues and go beyond the sectorial policies and fragmentation within government. So this is crucial. And of course, the collaboration between the different actors. And we already, different presenters today touch upon that already, but I think it will be good to go back to that probably at the last session to expand that discussion and how to move forward on those collaborations. Between local governments and communities, between local governments and national governments, and between all of us and the international agencies and multilateral agencies. So without much talking from my side, it's a pleasure to have this session with 5 presenters also. We'll give them maximum 5 minutes to have some thoughts and share what they're actually doing in terms of measures and policies to tackle not just this emergency and pandemic, but also creating some important transformations in their cities and territories. The first one is Laia Bonet. who is the Vice Mayor of Barcelona, in charge of the 2030 agenda and international relations, but at the same time, and this is very interesting, part of the metropolitan coordination in the Barcelona metropolitan area. So thank you very much, Laia, for being with us.